Welcome to Dr. T again today. And today we'll be looking at doing a question and answer live session. Um, we're waiting for others, so we'll just give. If you can hear me, say yes. Please do let me know if you can hear me. Good evening, Samuel. Good evening, Otama Sachs. Good evening, Ayobami. Yes, so someone has said yes. Absolutely. Please do not forget to invite your friends, family, and friends to this session. Also, share. And if you have not subscribed to this channel, please do well to subscribe and press on that notification button so that you can get notified of our live videos as they whenever we go on live or on get notified about our videos as they drop. Hope our week has been is good so far. So do we give some more time to wait for some people for more people to join? Yeah, I think we should. So because we've got 3 people on now. Good evening, good evening, good evening. Also, so like I said, this is Dr. T channel. Welcome to our channel today again this week. And this session is sponsored by Dofa Health Foundation, which is Dorcas Orelola, and Felicia Adeyola Health Foundation. And the aim of this foundation is to promote quality healthcare, especially in Africa and Nigeria. And this is one of the ways disseminating health information, appropriate health information is one of the goals of the Health Foundation. So this session is sponsored by them. And also the rules of this session is, this is as you are or you may be aware, this is a live question and answer session in which I will be throwing some questions to the audience, and the first person to get the answer is eligible or will get 5,000 naira. So that is the rule of the game. Be kind with your words, be nice, and make sure to share as we go on. Thank you. God bless all the sponsors. Thank you. Oh, somebody said I'm looking stunning tonight. Thank you. Thank you for that. Thank you for that. We'll just give maybe 2 more minutes to wait and see if more people will join, because the aim of this program really is to make sure as many people as possible are aware of important health tips and information, because it is quite life-changing. Information is power, as we know. Some people do not know that, maybe what they are doing or what they are exposed to can cause harm. And also because of what is going on, economic situation of the country, it is important to be in good health so that you don't have to spend money on medications or drugs. Absolutely, we do not want that. Okay. Thank you, Samuel. You've joined right from the beginning. Thank you. Emanuela saying, how nice. Thank you very much for your kind words. Thank you. So, like I said again, just in case you're just joining us, the rule of the game is the fastest finger wins or gets a prize of 5,000 naira. So the fastest correct finger, so not the fastest finger to just type anything, the fastest correct finger wins a prize of 5,000 naira. Okay, so I think we've given enough time for people to join, and maybe people will join as time goes on. So our first question for today is, today we'll be looking at different parts of health. So I'm not going to be focusing on only one aspect of health. I'm going to be going around different areas of health so that we can broaden our knowledge base. Good evening, Olumide Promise. Thank you very much for joining. And if for those joining, if you've not yet subscribed to this channel, please do well. Do good to kindly subscribe and press on the notification button so that you can get notified as our videos drop. The first question of the day is, what do male condoms offer that other forms of contraception do not? Remember, the rule of this game of this session is the fastest correct finger. The fastest correct finger gets to win a sum of 5,000 naira. And it is important to know that YouTube is not involved in this program at all. This is solely sponsored by Dofa Health Foundation. So we are waiting. What do male condoms offer that other forms of contraception do not offer? That is the question. So question 1. Yes. So Emanuela got it. Please, admin, moderator, please kindly help me note that name down. Yes, so that goes to Emanuela, saying that they reduce sexually transmitted infection and used ones cannot be reused. Absolutely. So they offer, Otamasax, you were the second. Yes, they offer more protection. So they reduce the chances of sexually transmitted infection. Other forms of contraception can prevent pregnancy, but alongside prevention of pregnancy, condom also protects the users from sexually transmitted infections such as HIV, gonorrhea, syphilis, genital warts, cold sores in the genitals, herpes simplex virus, and human papilloma virus. So it is very important, especially if you have a new partner, you are not sure of the status of this person, of your new partner, of your new sexual partner. You are not sure. It is important to protect yourself with condom, be it male or female condom. I hope you know that we've got female condoms as well. Okay, so second question: how many times should you brush your teeth in a day? How many times should you brush your teeth in a day? Emanuela is not giving room for it. She's all out to get all out or everything today. Absolutely, twice. So that is the minimum. So minimum of twice a day. It is recommended to brush your teeth minimum of twice a day. Some, authorities advocate brushing your teeth after breakfast, and most importantly, before bedtime. So you brush your teeth before bedtime and any other time of the day. And you should brush your teeth for a total duration of 2 minutes. It is very important. This will help prevent mouth odor, prevent caries in your teeth, and just generally give you a good oral health. So that goes to Emanuela said, just because she just came from the dentist. Yes, absolutely. That is good. Absolutely. So most people, that's now we're going to the third question. And if you're just joining this session, this session is sponsored by Dofa Health Foundation, And the aim of the foundation is to promote quality health care in Africa, Nigeria especially. And the rule of this game is I will be throwing out some questions, and the fastest correct finger gets to win a 5,000 naira. And it is important to know that YouTube does not have any uh, YouTube is not sponsoring or does not have any role in this game. It does not. YouTube is not involved at all. We're just using the platform. We're grateful to them, but they are not involved in this at all. So, number three, the third question: most people with hepatitis B know that they have the infection. True or false? Most people with hepatitis B know that they have the infection. True or false? Beautiful. Yes. Samuel has got this. Oh, no, 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 sorry. Samuel said true. No. Emanuela says false. Absolutely false. So most people with hepatitis B do not know, they do not know that they've got this infection. They do not know that they've got this infection. In fact, it has been found that 9 out of 10 people living with hepatitis B are not aware that they've got hepatitis B. And yes, it is a common infection that affects the liver and can cause a liver damage, liver cancer. So it is important to get tested for it. Number four, who mention 4 ways somebody can get hepatitis B. 4 ways someone can get hepatitis B. Yeah, we are waiting. 4 ways a person can get hepatitis B. Otamasak says injections. That's 4. So we need 4. So Emanuela again says through birth, blood contact, sex, and unsafe infections. Absolutely. So correct. Unsafe injections. So what kind of injections? What do you mean by unsafe injections? Someone says sexual contact, sharing of needles, syringes, and during pregnancy. Okay, exposure to sharp instruments. Emanuela has clarified. Absolutely. So, hepatitis B can be gotten through mother to child transmission during delivery. It can also be gotten through sharing of sharp instruments, or if someone goes to the chemist and gets injections and the injections are not sterilized, then a person can get hepatitis B. It can also be gotten through contact. So commonly, this one happens commonly in children. Contact of body fluids with open wounds or sores, such as saliva, sweat, contacting like wounds or sores. Absolutely. And then sexual transmission. So it is very common, and hepatitis B is commonly transmitted during childhood, where children play around, they mix up contact with fluids, with saliva, tears, sweat. So it is important as a parent to get your children vaccinated against hepatitis B. And if you are now in Nigeria, the hepatitis B is part of the immunization, the vaccination, the national vaccination um, protocol. But for adults, that wasn't part of the vaccination schedule when you were a child. You do need to get, tested for hepatitis B. It is very, very important. You do need to get tested for hepatitis B. Also, it's important to know that through people that do tattooing, piercing, barbers, they can, hepatitis B can be shared, can be transmitted. Circumcision. Okay, so how many have we done? 1, 2, 3, 1, 2, 3, 4. So we're going on to the 5th question. What are the effects of smoking on the lungs? What are the effects of smoking on the lungs? Effects of smoking on the lungs. Fastest finger. Otamasak says lung cancer. Yes. Absolutely. I'll give that to you. So lung cancer, smoking is the commonest cause of lung cancer. And apart from, yes, Samuel says emphysema, chronic bronchitis, and lung cancer. I think I'll give that to Samuel now because you're more detailed in your answer. So smoking can cause chronic obstructive airway disease, such as bronchitis, chronic bronchitis, emphysema, and lung cancer. So if you smoke, it is advisable for you to stop smoking. If you have anyone, your family or your friends that smoke, kindly, tell them the risk of smoking. And this is just on the lungs. So smoking can affect other parts of the body, such as the heart. It can cause heart disease. It can cause even exposure to, causing other forms of cancers as well. And it can cause stroke. It can cause hypertension. So effect of smoking is more than the benefits. I find it difficult to even know the benefit of smoking apart from maybe you're enjoying the nicotine effect, but the side effect is very, very grave and nobody wants it. So if you know anyone that is smoking or struggling to smoke, or struggling to stop it, please, you can tell them to go to see a healthcare professional that will give them some medications or tips to help them stop. Absolutely, smoking is injurious to your health, and smokers are liable to die young. That is on the cigarette case. It is there. So even the manufacturers, they tell you smoking is not fun. Please stop smoking today. So yes, Samuel says some says it relieves cold. Some say that, but absolutely, the ill effect is much more than the advantage. So the disadvantage is much more than the advantage. So we'll employ you to stop it today. Okay, so going on to the 6th question. Second-hand smoking or passive smoking is dangerous or not? Yes or no? Passive or second-hand smoking is dangerous. Oh, Samuel has, yes, he said yes. Yes, yes, yes. Dangerous. So he said yes, and then so I'm giving it to Samuel. Dangerous, absolutely. And what is passive smoking? Passive smoking is you're not smoking directly, but you are inhaling the smoke by that other people are bringing out. So maybe you live with a smoker, or you're friends with a smoker, or they're smoking heavily around you. You are a passive smoker, and it is very dangerous. In fact, according to CDC, it contributes to approximately 41,000 deaths among non-smoking adults and 400 deaths in infants each year. It can cause, side effects, cause health problems like lung problems, lung cancer, heart disease, as we said. And in children, it's very important to state this, that in children exposed to secondhand smoke, they are at increased risk of middle ear infection, respiratory tract infection, severe asthma, sudden death. So, sudden infant death syndrome. So, are you a parent smoking? Please try your possible best to stop it, especially when you've got children, because infant children, because it can actually kill. It can kill. Yes. So let's go on. For people that are just joining, this session is brought to us by is sponsored by DOFA Health Foundation, and the aim of this foundation is to promote quality health care amongst sub-Saharan Africa, especially Nigeria. Please do well to subscribe to this channel. Click on the notification button, like and share our content. Thank you. So, going on to the seventh question. Apart from love, what else do you need to know about your spouse to be before marriage? So, I believe you need to know that you love your spouse to be. But apart from that, what else do you need to? Oh, Ayobami Bose says network is making my answer slow. Oh dear. Oh dear. Okay. What do we do? Uh so Samuela said genotype. Emanuela says trust, security, genotype, blood group. Is there more answer? Ayobami Bose, do we have more? So someone has said genotype. Okay. So Ayobami Bose says genotype, blood group, health issues. What do you mean by health issues? Health issues like general health screen. Can you be more specific about that? General health screen. Emanuela says hepatitis and all the tests. Be more specific. I want more specific answers. Genotype, blood group, health issues, general health screen, HIV status, hepatitis and all the tests. It's difficult to know all general health screening. So if you're saying all general health screening, I'm not entirely sure what you mean by that. Emanuela and Ayobami Bose. Yes, I know. Samuel says genotype. Absolutely. Genotype is very important. Genotype you need to know, especially in sub-Saharan Africa, where we've got the sickle cell trait and sickle cell disease. It is very, very important to know your spouse to be's genotype, because if you are AS, it it is not advisable to marry AS because your chances of having a sickle cell disease a child with a sickle cell disease is 25%. That is 1 in 4 chance. So for every pregnancy, that child has got 1 in 4, a 25% chance of being a sickle cell patient. And absolutely, it is very, very important. Sickle cell disease is can be a very painful condition, and it is advisable to avoid bringing children with it. It's not advisable for you to have children that will be sickle cell disease. It is very painful for the children, painful for the family, painful for the parents. Seeing your child in so much pain, nobody wants that. Ayobami Bossa says blood disorder test, STD, genotype, thalassemia test. Yes, you can. More especially just thalassemia in the Asian, Middle East and Asian. Yeah, you can check that. So fertility, I wouldn't really advise fertility, because even if you do a test of fertility, there's a well, people can be infertile and they won't even know the cause of it. So you may do all the tests, you may be normal, and you will still be, you can still be infertile. So I don't think that is what we should be looking at. So do we all agree that we should kindly give Ayobami said this? Yes, just because she says an answer has been slow in coming on. Absolutely. Even though Emanuela and Samuel also, where they got the answer. Oh, Samuel, thank you. So this goes to Ayobami Bosse. Yes. So I would say before you marry, before you marry, the premarital test you should do yourself and your spouse include genotype. Know your genotypes. It's very, very important. Know your genotype. Secondly, check for sexually transmitted infection. It is very important. Yes, Emanuela, thank you very much. Yes, test for sexually transmitted infections such as HIV, gonorrhea, syphilis, but the common ones that we do test for is HIV, hepatitis B and C. It is very important, please. There is no, yes, love can be blind, but sometimes they do say marriage opens it. You do not want to get yourself, you do not want to find out that you've got, a sexually transmitted infection from your partner. If you know before you marry, and you still decide or agree to go ahead, that is fine. But it should be from a place of knowledge. It should be from a place of knowledge. Absolutely. So that goes to Ayobami Bosse. Okay. So another question: having frequent fever, headache, and joint pains in Africa is always malaria. Yes, absolutely. Yes, you're right, Ayobami Bose. Yes, so having frequent fever, headache, and joint pains in Africa is always malaria. True or false? Okay, Emanuela says yes. Samuel says yes. Ayobami says no. Otama says not really. Yes. So I will give it to Otama Sachs. No, not really. Absolutely. So that is one of the misconceptions about fever or febrile illness in Africa, and that is why we've seen a lot of chronic diseases that were not picked up early. So if you find yourself having frequent fever, headaches, body pains, do not just assume. Don't assume that it is malaria. Please ensure to see a healthcare professional. And when I say a healthcare professional, I mean, go to a qualified healthcare professional. Do not go to chemists to say, oh, can you just give me malaria medication? Or maybe walk into the lab yourself and they are testing you for malaria and typhoid. No, if you find yourself, you've treated malaria and it is not going, you keep having the fever, you keep having the body pains, headaches, please seek a second opinion. Make sure to see a healthcare professional because it can be anything really. It can range from infections, bacterial infection, to autoimmune disease like the body fighting against itself. It can even be cancer. So it is very important, something malignant. It is very important to always seek second opinion. Stop when you treated malaria and it is not going. Please pause and make sure to see a healthcare professional. The last question for this session. The last question. Thank you. Does a man's libido reduce as he grows older? Does a man's libido reduce as he grows older? Samuel says yes. Yes. So we give that to Samuel. That's the fastest correct finger. Yes. It can reduce as a man's libido can reduce as they grow older. In fact, authorities have said that testosterone, which is the male sex hormone, can reduce as one grows older. In fact, it's been found that it reduces at the rate of 1% per year. This can significantly affect or not significantly affect sex drive. And also other things can also affect sex drive. Other things like medications that a man is taking, maybe like medications like antidepressants, blood pressure tablets can affect sex drive. And it is important to also seek medical attention if you have continued reduced libido, because do not just assume that it is your age. Make sure to seek medical help or seek help from a health care professional. Okay, so that is all the questions for today. I think we've done well. This is more than half an hour. Our aim is just a short session, half an hour session of just asking questions so we can talk about these issues and we also learn. So aim is to learn and to earn. So thank you so much for everyone that joined today. Um, uh, Samuel, Emanuela, Ayobami Bosse, Olumide Promise. Thank you, thank you, thank you. And we will, like I said, please kindly subscribe to this channel and click on the notification button because so you can get notified anytime we go live. Also, kindly, inform your family and friends of this channel. Help us to grow this channel because our aim is to disseminate quality health information to as many people as possible. Thank you, thank you, thank you, Otama Sachs. Thank you, Ayobami Bosse. And kindly, I don't know, I think you may have to send me a message for everyone that won a prize or wants from this session. Kindly send me your bank account details in Naira and I will send you your prize money. Thank you again. See you next time. Remember to subscribe and click on the notification button. Also share this YouTube channel with your friends and family. Thank you. Bye.